Good morning, everyone. My name is Sylvia Soltis, and I am a senior staff attorney at Legal Aid in our pro bono program. I am joined today by my colleagues, Andrew Patterson, a senior staff attorney in Legal Aid's Public Benefits Unit, and Jess Davis Ricci, a staff attorney in Whitman Walker's Legal Services Department. A few quick housekeeping items before we dive in. We are recording this training, so I am asking that you please take the opportunity, if you are not already muted, please mute yourself. If you have questions throughout the training, you're more than welcome to type them into the chat, and we will answer all questions at the end of the training. So we thank you for your patience as we get through a lot of material. It's hard to believe, but this is our 16th Medicare Part D season, and our third one being conducted virtually. Whether you've been with us, since the beginning, or if this is your first Medicare Part D enrollment season, we're grateful to have you with us and sharing your time. We have a lot to cover today. So I'm going to turn it over to Andrew, who will help us dive right in. Thanks again.
Good morning, everyone. I'm Andrew Patterson, senior staff attorney with the Legal Aid Society of DC. And as Sylvia said, we do have a lot to cover, so I'm going to get started with the first segment of our training. So the training overview today is going to capture a few different things. We're going to talk about the Medicare Part D counseling process. We're going to provide just some sort of background on Medicare, Medicaid, QMB, and the low-income subsidy, which are cost-sharing assistance programs. We're going to walk you through the Medicare.gov/plan finder to show you how to analyze a client's drug needs and select a plan that best meets those needs. And then we'll just have a Q&A at the end after our wrap up, and we'll go on to some next steps. So first of all, what is Medicare? I think people are probably generally familiar with the idea of Medicare, but to talk about it in a little more detail, Medicare is a federal health insurance program that consists of several different parts. Part A is hospitalization insurance. Part A is only really implicated when someone is an inpatient in a hospital setting. Medicare Part B is what we think of as standard sort of health insurance, which covers things like primary care, specialty care, outpatient services, and the like. Medicare Part B does have a monthly premium that is generally withheld from someone's Social Security check. That's going to be about $164.90 per month, but it could be a little bit higher depending on the person's income. Medicare Part C is Medicare Advantage. That is sort of a privatized version of Medicare Part A and B, or Medicare Part A and B and D. As a very general rule, like if some of your clients may be enrolled in Medicare Part C plans, if you have questions about that, that's a really good opportunity to talk to your mentor. As a very general rule, we tend to counsel against enrollment in Medicare Advantage for a variety of reasons. But that said, sometimes people are enrolled in them and they do okay with their health. But again, that can be something to go over with your mentor if your client has any questions. And then Medicare Part D is what we're going to spend the bulk of our time talking about today. That is the prescription drug benefit. These are private prescription drug plans that differ by cost and by covered medications. So how does Medicare Part D work? Sorry about that. As I said, there are private prescription drug plans that are essentially competing for business. In 2023, there are going to be 22 standalone Medicare Part D plans in Washington, D.C. 5 of those plans will be what are considered low income subsidy or no premium plans for people who are low income. There is an annual open enrollment, which is why we do this project at this time of year, also called the open season. That runs each year from October 15th through December 7th. Any change in plans that is made during the open enrollment is effective on January 1st of the following year. Most people can only change plans during this time frame. There is some overlap with the Affordable Care Act or Obamacare's open enrollment season. Sometimes people can get a little bit confused about that. Those open seasons are noted below, but this is just for Medicare Part D, this project. And there are subsidies for low-income beneficiaries. People who are enrolled in the low-income subsidy do have more generous enrollment. There are more generous rules around enrollment and plan changes, not as generous as they used to be, but we will talk about that in a later slide. So I'm going to spend a few minutes now and talk about the cost sharing assistance that is available to low-income DC residents who have Medicare. The primary one for Medicare Part D is called the Low Income Subsidy. You may also hear it referred to as LIS. This is financial help for paying Medicare Part D costs. So the low income subsidy by itself is just limited to Medicare Part D. When people are enrolled in the low income subsidy, there are several ways that they are able to save a substantial amount of money. First is they do not have a premium, assuming their Medicare plan is one of the LIS plans. They will have no monthly premium, no deductible, and no donut hole for as their initial costs for Medicare Part D. They will also have lower copays that are limited in their dollar amount, depending on the level of subsidy that they have. So people who have full Medicaid will pay $1.45 for generic drugs and $4.30. I'm sorry, will pay $1.45 or $4.15. People who have the next step up in the subsidy, not the full subsidy, will pay $4.30 for generic drugs and $10.35 for brand name drugs. Depending on individual plans, some medications may just have a $0 copayment, even though they are allowed to charge up to those amounts. And generally speaking, people will have a $0 copayment after their total prescription drug costs surpass the catastrophic coverage amount, which for 2023 will be $7,400. So in addition to the low income subsidy, there are a couple of other types of assistance that people can qualify for, assuming they financially qualify. We just talked about the low income subsidy, which, as I said, is a Medicare Part D cost sharing assistance. In Washington, DC, basically everyone who qualifies for the low income subsidy will also qualify for the next step of assistance, which is called the Qualified Medicare Beneficiary Program, or QMB. People, in order to apply for the low income subsidy, people generally apply through the Social Security Administration. QMB, however, is a Medicaid program. So even though it is not full Medicaid, it is administered locally by the same office that administers Medicaid, which is the Economic Security Administration, or ESA. ESA is a part of the DC Department of Human Services. And so people who think they may qualify for QMB would not apply it through Social Security, but would apply instead through the Economic Security Administration. Once someone is enrolled in QMB, then they are automatically enrolled in the low income subsidy program. So they do not have to apply separately for the low income subsidy through Social Security. And people who have QMB, in addition to getting all of the benefits of the low income subsidy, also get additional cost sharing assistance for their Medicare. So the QMB program will pay for someone's Medicare Part B premium. It eliminates copays and deductibles for Medicare covered services as well. Now, as I said, QMB is Medicaid funded, but it is not Medicaid. So it does not pay for health services that are not covered by Medicare. All it does is lower the cost of Medicare covered health services. And it also does not pay for medications that are excluded from the Medicare formulary. A little bit later, we'll talk about some medications that are just not covered by Medicare, regardless of the Part D plan. And QMB is not a way to get those medications covered. People who are exceptionally low income, essentially below 100% of the federal poverty level, who live in DC and have Medicare, can also qualify for full Medicaid benefits in addition to QMB. Like QMB, Medicaid is administered locally by the Economic Security Administration, so people would apply through the DC Economic Security Administration for that assistance if they think they qualify. In addition to the low-income subsidy, people who are enrolled in Medicaid are also automatically enrolled in QMB, assuming they also have Medicare. But beyond the low-income subsidy and beyond QMB, full Medicaid also does pay for some types of health services that are not covered by Medicare. The two biggest and most important examples of that, I think, are dental benefits and a much more robust home health services benefit. Those are two areas that Medicare does not provide much coverage at all in, especially traditional Medicare. Some people can get like some small dental benefits through a Medicare Advantage plan, but by and large, there's no dental benefit or robust long-term home health services program in Medicare. So people can get access to those health services through DC Medicaid. And additionally, there are some types of medications that are covered by Medicaid that may not be covered by Medicare. So how do we help Medicare Part D beneficiaries meet their prescription drug needs in 2022? That should say 2023. First is to confirm the current and future low-income subsidy, Medicaid, or QMB eligibility or enrollment. So we want to make sure that people are getting the cost-sharing assistance that they are entitled to. One key way to determine whether someone is getting cost-sharing assistance is to ask whether a Medicare Part B premium is being withheld from their Social Security check. That will tell you whether someone who has Medicare is enrolled in either Medicaid or QMB. If someone is having Part B premiums withheld, that's a red flag, and we can almost always get that fixed. But we want to make sure that people have the correct cost-sharing assistance. After that, we want to make sure that people have a My Medicare login. The My Medicare login was new several years ago. I think most of the clients that we have assisted in the past and most of the clients that will be referred out will already have a My Medicare login, but it's possible that some may not. So we'll go through how to create a My Medicare login, password, security question. At step 3, you will analyze which Medicare Part D plan is going to be best for that beneficiary. And that analysis is done through the My Medicare, the Medicare.gov Plan Finder and Plan Compare. And we're going to walk through that in the online protocol later in this training. And then in consultation with your, well, if it's beneficial, you will enroll or change a Medicare Part D plan online. You can either do that online or you can do it by telephone with an insurance company. And then in consultation with your mentor, you can advise clients who are in plans that are not working for them but cannot change at this time. So in some situations, people may not be able to change, but we can still provide, or there may not be a great option for them, but we can still try to give them some type of assistance. So at this point, I'm going to turn the presentation over to Jess Davis-Ricci with Whitman Walker to walk through the next few slides.
Thank you, Andrew. Hi, everyone. Jess Davis-Ricci, staff attorney, Whitman Walker Health Legal Services Program, and I use they, them pronouns. So in this section, we're going to review the first step, which I would say are the 3 main steps of what you'll be doing, which is the Part D plan analysis. So the main step is how are you going to begin or log in? And that can be through a personalized search with someone's My Medicare account information, as Andrew just mentioned, or if we don't have that, or if it doesn't work, you can do a general search, and we'll talk more about that later. The second component, after you've sort of gotten them logged in, is confirming and updating the person's drug and pharmacy information. And we'll go into the details of that later on. I'm going to walk everyone through a general search analysis on the Plan Finder site. So we'll go through that at the end. And then we'll also show you, what you're looking at in a plan comparison how you do the analysis for that, and the enrollment steps. So we'll do all that at the end, but right now we're going to talk about just navigating the initial plan comparison site. So the image we have here for folks who volunteered with us last year or attended this training, this is the main page. So you're always going to use this if you want to bookmark it. It's Medicare.gov Plan Compare rather than having to click through just the plain Medicare.gov site. So this homepage is going to be updated throughout the year. It's going to have different graphics. Now, it's got a picture of a different person, and we have screenshots of the current in the protocol, online protocol that you received in your training materials. So when you go, you'll see the newer images. But the main thing about this page is, it's going to keep changing. But what we're really looking for on this page is the login or create account button in the middle, or the continue without logging in. And that's going to be the general search process. So we're going to talk about that in more detail. But this page is going to look different every year. But the main thing we're looking for is whether you're logging in with somebody's My Medicare account credentials, you're creating an account for them, or you're doing a general search, and that's continuing without logging in. All right. Okay, so if you get a case from us, many of our past clients, as Andrew said, have My Medicare accounts already set up. So if we know that the client has an account set up, you will receive those credentials, those login credentials, excuse me, in the training material, in the case placement materials that you receive when you take on cases. And you should be able to enter that username and password here and log in easy peasy. But what happens, we find, is many clients change this information since last year. Some clients have created their own accounts. And in a lot of situations, we're working with, obviously elder populations, and folks don't remember, or maybe have lost the paper or the thing where they wrote it down last year. There is a way that you can recover an account through, like normally that you would see, there's a series of security questions to recover. Oftentimes, that is also a struggle for the client. So you do have the opportunity, if someone says, I know I have an account, let me go find it, you can contact the client to get that information. But a lot of times in that case, it's better to just do a generalized search because it's often difficult to find that contact information if it's not included in the case placement. If the client doesn't have an account and you speak with them and they're like, oh yeah, I'd be willing to do that, then you can create a My Medicare account for them. And that way you'll be able to log in at the same page with their personalized information. And we'll show you that on the next screen, which is the create account button at the bottom there. All right, so once you click that create account button, and again, that graphic will look different each year on the Medicare site, but you're looking to create, and that's the button you're looking for. All the questions on that first page are trying to identify the record holder. And so all of this information will be in the Part D intake form that is also a part of your case placement packet. So it's going to have the Medicare number, last name. It's important if the client has written their name differently that you use what's on the Medicare card. It should be accurate based on the intake that you get. But sometimes we do have issues where clients forget to add that they're a junior. A lot of times we've caught that, but that's a different name in the system. So it's important to have those. Usually we're able to catch those on the front end, but that could create an issue. The coverage start date is at the bottom of the red, white, and blue My Medicare card pictured here, the hospital Part A that Andrew discussed earlier. And so you're just really going to need the month and the year, but it needs to be entered as it's written, and that should be in the Part D intake form as well. Email is not required. There is a section to put email. Even if the client has an email listed in their Part D intake form, I think it's okay to say that the client does not have an email, because otherwise then it will start sending a bunch of, of account emails to the client. And often that can be very confusing, especially if the person's like, please open up an account for me for my help, but I don't really use my computer, or, maybe they have it just on their cell phone. So it's okay, even if the person has an email, to not put that in when you're sort of doing this identifying information. Date of birth, zip code, that's all on the intake. And then at the bottom, there are some security questions just saying, you're not doing this for a fraudulent purpose. You can read through that. It's a pop-up box. and then you'll click next to proceed. So if that information is correct and matches a record in the system for someone who does not have an account, then you should be taken to the page where you can create the person's username and password for their My Medicare account. Now, again, in your case placement materials, there will be a My Medicare account template form, and that form actually has the template username and passwords that we use based on clients' name and date of birth, just to standardize. So you don't really have to like think it up or confirm with the client. You can just use the standardized. It's all highlighted in the form there. And then you can create that person's username and password based on the template. It's really, really important if you do this, and I'll repeat this a couple of times, that you save that PDF and that you make sure it gets back to your mentoring organization. The main thing is just that we have it in the case. We keep a repository of these so that we're able to help these folks year by year. So it's really important that we have it. So make sure it gets back to your mentoring. Make sure you mention it, that you created one, and also it gets back to your mentoring attorney. And once you create the username and password, it will then ask you to log in. So you'll go ahead and enter it, and then you'll be taken to the Plan Finder website. So that would be the beginning of a personalized search once you've logged in with the person's account. So once you begin that search, the big thing here, it'll again, these graphics will look different every year in the personalized search. But and there's again in the online protocol, there's a picture of the current website image graphic. But the main thing is when you're doing the plan search, it's always going to prompt you what kind of plan that you're looking for. And what we're doing is exclusively Part D. It's not any of the other options here. So you're always going to, whenever this option comes up of what kind of plan you're looking for, it's always going to be drug plan Part D. And then you want to make sure you're entering the zip code that the client's their home address where they're listed at. And then you're ready to proceed with the logging in. Okay, so as we mentioned, that's sort of the point where you're going to start your drug and pharmacy updates, which we'll show later on. But that's sort of how you get into a personal search or create an account for someone. In this section, we're going to move on to what you would do in a general search. So a general search just means you're not logged into someone's account. So anyone can come onto this website and search, zip code, their pharmacy, and their drugs, and get a comparison. So we're going to use this sort of general feature. The main concern I would say that I have when I do a general search is if a client has a long list of medications and you have to enter in each one of those medications, you really don't want to accidentally hit the back button or X out of that screen, and then you have to start all over again. So that's the one drawback about a general search, is it's not in the account. So in the person's account, you're just editing a drug list that's already saved to it. In this, you're having to create everything from scratch. So if a person has only a few drugs, it's not a big deal. But if a person has a long drug list, it can be a little more time consuming. So to begin the general search from that main login page, it's the second option, right? Which was continue without logging in. And so again, those graphics are going to change, but if you're doing a general search, you're looking for continue without logging in. So the general search will allow you to analyze the client's prescription drug needs in the same way as a personalized search. But the second main important difference about general search is that you have to identify for the plan finder what this person's cost assistance level is with Medicare. So Andrew went through that list of different Medicaid, QMB, these different programs that provide cost sharing assistance and extra help. So when you log into someone's personalized account, it's going to show you, like in that graphic we just saw 2 slides ago, it's going to show you that person has full extra help. And that means $0 premiums and capped copay costs. And so that's going to be displayed. With the general search, you have to input that information. And so it's really important in this section to make sure everything is accurate. And that way, the plan results that you get back will have the most accurate copay costs and also premium costs for the individual. So to recap, you're going to use general search if you enter the person's information and it says there's no record found, or you try to use their My Medicare account login information provided and it says, you know, incorrect credentials, or the client can't remember, you know, if anything fails with the login, personalized search login process, then you'll move on to the general search. The other situation that happens sometimes is if you do a personal search and you see in your intake that the client has QMB, so the client has cost sharing assistance, and when you log into their personalized search, the portion that shows cost assistance says there's no coverage. So basically, if the person's account is not showing their correct level of Medicaid or QMB status, so that $0 premium amount, then it might, first of all, alert your mentor of that discrepancy, so that we can look at it from, you know, about the back end of the public benefits side of it. But I would go ahead and proceed with the general search, entering in the benefits that you know they have. So you can enter in yourself their Medicaid, their SSI, their QMB status. Okay, and again, just like we saw when we were doing a personalized search, when you do continue without logging in and you do the general search, you're still going to make sure we're looking at Part D drug plan only coverage, and again, entering the zip code that matches the person's home address in their intake. Okay, and so here's the point that we discussed. The next question will ask you, what is this person's level of financial assistance? And so one tip to remember, and this is also listed in the online protocol. I know there's a lot of information and it's all detailed click by click in the online protocol, so don't worry. If your client is getting QMB, then that is what they list in this section as Medicare Savings Program. So there's several of them, but in DC, typically that's going to be QMB. So just in case you're like, that's not listed on here, but there's also a link here that says learn more about these programs, and QMB is listed on that link if you want to double check. So one important point is you want to select the highest level of cost assistance that the person has. And if you don't know what that means, it's listed out here. So if your client has QMB, so if you know, you're in your intake, you're in the Part B public benefits verification section, and it lists that the person is getting QMB and they're getting Medicaid. So when you get to the selection, you're going to choose Medicaid because Medicaid is sort of for the neediest. And so that means that it's going to have the greatest amount of coverage, and that's going to be the client's closer of an approximation to the client's realized copay costs. And that's why we really want to make sure that you're using sort of the highest form of coverage that they have, or for the neediest. And so if the client has QMB and Medicaid, you'll choose Medicaid over just QMB. If the client only has QMB, obviously you'll select Medicare Savings Program. If your client gets Medicaid, QMB, and Supplemental Security Income, so SSI, you'll select SSI because that's for, you know, the needy and disabled, right? So that's an even needier, or the needy and elderly. So that's an even needier program. And so when you come in here, if the client has all three listed, you'll select SSI, and that will give the most accurate copay in the plan comparison. If you aren't sure about which box to check based on the intake form, definitely get together with your mentor to you know, figure out which one is best to select here. Again, with the general search, it is important because it's going to give you the most accurate copay estimates at the end, copay and premium estimates. And then once you click next from this screen, you're essentially at the same point that you would have been if you did the personalized search, if you just logged in. It's a couple extra steps. But at this point now, we're getting to entering drugs and pharmacy information, and I'll show you all of that after Andrew, and we'll do the analysis together. Thank you.
Thank you, Jess. So I'm going to talk now a little bit more about some of the cost sharing assistance, and then the process, the sort of advising your client process for how to help them select a plan. Jess will go through the actual nuts and bolts of the enrollment online, but I'm going to talk at a higher level about what the process looks like. So first, I'm going to talk about the cost sharing structure for unsubsidized Medicare Part D beneficiaries. Unsubsidized meaning people who do not qualify for any financial cost sharing assistance at all. So for Medicare Part D in 2023, as I said, first thing is there is a Medicare Part D premium. Those premiums range from $7.60 per month to $112 per month, depending on the specific Part D plan. There is a benchmark of $39.22 per month for the DC and I believe Maryland and Virginia area. This $39.22 premium amount is the amount that determines whether someone who does receive cost sharing assistance will have a $0 premium or will have some premium that they still have to pay. So the low income subsidy will pay for $39.22 of Medicare Part D premium. If they select a plan that has a larger premium than that, they will have to pay the difference. There is also a Medicare Part D deductible. So the enrollee is responsible for 100% of the medication's cost up to $505. That deductible goes up a little bit each year. There is then what's called an initial coverage period. That is when the total cost of medications is between $505 and $4,660. During that, the enrollee pays 25% and the prescription drug plan pays for 75% of the cost of medications. In years past, there used to be what was called a donut hole between the next step up, which was $4,660 and $7,400. Originally, during, before the donut hole was closed, that meant that the enrollee would have to pay a much higher portion of the cost of their medication. But as it stands now, the enrollee gets a 75% discount on the full cost of premium and generic drugs. Once the total medication costs have hit $7,400 for the year, the enrollee then enters what's called catastrophic coverage, in which they will pay a smaller copay for the cost of their medication. They will pay either a 5% coinsurance, or they will pay $10.35 as a copay for a brand name drug and $4.30 as a copay for a generic drug, whichever is higher between those dollar copay amounts or the 5% copay insurance amount. I spoke a little bit earlier about how people are allowed to change their plans. Typical Medicare enrollees who do not receive any subsidy are only allowed to change their plan during the annual open enrollment. It used to be the case that for people who received the low income subsidy or QMB, that they were allowed to change their plan every month, with the change effective the first of the following month. However, that rule changed in 2019. And while they are still able to change their plans on a more generous schedule than simply being limited to the open season, it is now more restrictive than it used to be. The way that it works is for the first 3 quarters of the year, of the calendar year, an enrollee is allowed to change their plan once. And that plan change is effective the first of the following month. So at any point between January and March, a person can elect to change their Part D plan if they need to, and it will be effective the first of that following month. But then at that point, they have used up their opportunity to change their plan in that quarter, and they would have to wait until the following quarter if they wanted to do yet another plan change outside of the open season. And then for the 4th quarter of the year, enrollees are limited to changing their plan during the open enrollment period. And those plan changes are effective on January 1st. So essentially, people have to do their plan change for the following year during the open enrollment period, but then once per quarter for the first 3 quarters of the following year, people are allowed to change their plan if it's necessary for them to do so. So I'm now going to talk at sort of a higher level about the Part D counseling process and the steps that you're going to take to help ensure that a person is getting the best prescription drug coverage through Medicare that they can. So step one is the low income subsidy review, or LIS review. We want to make sure that people are enrolled in the proper cost sharing assistance for them. Are they enrolled in the low income subsidy and QMB or Medicaid, depending on their income? So one thing I'll just say briefly is I mentioned earlier that the income limit in DC for full Medicaid is 100% of the federal poverty level for people who have Medicare. There are some exceptions to that. If your client seems to have a higher income than that amount and they are still getting full Medicaid, it may not be wrong, but I would encourage you to talk to your mentor and just clarify and make sure that they're in the right program. People who have Medicare and who have more than 100% of the federal poverty level income, but who were below 300% of the federal poverty level, that is the group that is generally going to qualify for QMB. So up to 100% full Medicaid, between 100% and 300% of the federal poverty level, people should be enrolled in QMB. And as I said earlier, people who are enrolled in either Medicaid or QMB will automatically be enrolled in the low income subsidy. A good way to check, as I mentioned earlier, is money coming out of someone's Social Security check? If yes, then there is a possible problem with their QMB or Medicaid. And that is something that we can try to help get fixed outside of the Part D counseling process. We also want to know if someone is paying more than about $10.35 in co-payments per medication for a 1-month supply of their medication. If yes, that could also be an indication that there's a problem with their low income subsidy or copay. It could also mean that they're taking a drug that is not covered by their current plan. But again, that's something that we would want to know more about. We also want to know whether someone's low income subsidy or QMB status is going to continue for 2023. Even if someone is enrolled for 2022 or for the current year, is it going to carry over for the next year? As a result of the federal public health emergency, which is still in effect, Medicaid renewals have been auto-extended, but we don't know how long the federal public health emergency is going to last. The emergency may well expire soon, but at any rate, once it is over, people will have to renew their QMB and Medicaid again on a regular or annual basis. During normal times, when there is not a public health emergency in effect, the way to determine if someone's low income subsidy status is going to carry over into the following year is to try to get some information from the enrollee about when they were enrolled in QMB or Medicaid. If they were enrolled in Medicaid in July of the current year or after, then the low income subsidy is deemed to them for all of the following year, even if they lost that benefit at some point. If someone is enrolled in QMB or Medicaid at any time in 2023, then they are also deemed to have been enrolled in the low income subsidy for the rest of that year. So if anyone is enrolled, again, I'm just going to say this one more time because it's a little bit confusing. If anyone is enrolled in QMB or Medicaid in July of the year or after, then the low income subsidy portion of the benefit is deemed to them for the rest of the following year. Likewise, if anyone is enrolled in QMB or Medicaid at any time in the following year, so if someone is enrolled in QMB or Medicaid before July of next year, that low income subsidy should also be deemed to them for the rest of that following year, regardless of what happens to their QMB or Medicaid coverage. And you can just consult your mentor if you have any questions about someone's low income subsidy status. Once you have confirmed that someone is enrolled in the correct cost sharing assistance program, you want to review the Medicare Part D plan coverage for the following year. We've already talked about creating a My Medicare account with a login and password. Again, a lot of folks are already going to have that set up. If someone needs it, that's what we just went over. And you can also talk to your mentor if you have any trouble setting that up. If you're not able to find someone with a personalized search, again, that's where the generalized search tool can be really handy. You want to review the person's intake form. You want to make sure that you have all of the information. You can reach out to the client or to the mentor if any information is missing, but we, again, want to make sure that we have their low income subsidy and or QMB or Medicaid enrollment information correct. We want to make sure that we have the correct medication list, all of their medications and the dosages that they take, the frequency that they take them. One tip that I like to remind people is to just get the entire medication name from the bottle, not just sort of the colloquial name, but some medications are combined, some medications may have some letters after the main name of the drug, and all of that can help you really make sure that you have the exact medication that that person is taking. You want to know where they get their medications from, which pharmacy. Usually you want to get the name and also the location, the address. And you want to know what their current drug coverage is for 2022, because that's how we're going to compare the coverage for the following year. You'll want to know whether the client's Medicare Part D plan still exists and will be zero premium for the following year, or if they're going to be automatically switched to a new Part D plan. Also, it's a good time to check and see, if someone is currently enrolled in a Medicare Advantage plan, you can try to make sure that they haven't had any other problems with their health insurance coverage. So one of the primary problems and one of the reasons that we tend to be cautious about the Medicare Advantage plans is that Medicare Advantage plans tend to have their own network of in-network physicians and clinics and hospitals. So if someone is on traditional Medicare and they get enrolled in a Medicare Advantage plan, their primary doctor or specialist may accept traditional Medicare, but may not accept insurance through that Medicare Advantage plan. So if someone is enrolled in a Medicare Advantage plan, it's good to talk to them and make sure that we have an understanding not only of their prescription drug needs, but just to know if there are any other problems they've been having with their health coverage, because we can at least give some advice, or you can talk to your mentor and we can help them understand what enrolling in a standalone Medicare Part D plan instead of an Advantage plan going forward would mean for them. So now reviewing Medicare Part D coverage for 2023 using Medicare.gov. You'll want to review the plan details with the client. And it's helpful to keep in mind that generally speaking, clients prefer to not switch plans if possible. Clients will usually be open to it if there is a medication they need that won't be covered and it's going to be super expensive in the next year. But if if there are options that only offer a slight savings on a monthly basis for the next year, then people may prefer just not to go through the hassle of switching their Medicare plan. It means they need to get a new card. They have to take that information to the pharmacy. And that can sometimes be a hassle or a little bit of a pain. So people will generally want to avoid that if they can. As you're looking at their current plan versus other options for the following year, some things to consider are going to be out-of-pocket costs. That will be monthly premiums and co-payments that are added together to come up with essentially a monthly cost for that person's prescription drugs. It's also helpful to know if they have any other program like ADAP that is helping with certain medications or co-pays. You'll want to make sure that you're looking out for the client's current and future drug needs. If there are any drugs they take that are not covered by Medicare, and there's a memo in the training materials on that, that can be a way of helping make sure that people have all of their drug needs met. Is the drug covered as generic is another thing that you'll want to double check and make sure, because a lot of plans will cover generic versions of medications, even if they do not cover a name brand version of a medication. As you're considering individual plans for someone to enroll in, you'll want to check quantity limits, prior authorizations, and step therapies. Those are the most common limitations that can affect how someone is able to access their medications. A quantity limit is essentially what it sounds like. It's a limit on the number of pills someone is able to get in a certain period of time, usually a number of pills per month. A prior authorization usually just means that the plan has to give an okay for that person to get a specific medication. By and large, prior authorizations are not that challenging to get around. It may involve a call from the doctor to the insurance plan, but it usually doesn't involve much more than that. A step therapy, however, can be a more challenging restriction to overcome. A step therapy is usually a requirement that someone try a different medication or a more preferred medication, and that medication fails before the drug they are seeking coverage for will be approved. Sometimes people can get around to step therapy if they can establish they have already tried a previous medication, but sometimes plans are not willing to waive that, and people will have to either try a separate medication or look for a different plan. You can click on plan details, and again, we'll go over this in the online protocol, but you can click on plan details and then view more drug coverage to get a sense of what the drug restrictions are. You want to make sure that you have the pharmacy, again, so you can make sure that that pharmacy is a preferred pharmacy within the network of any Part D plan that you're considering. And then you also want to take a look at the star rating. That's essentially the plan's reputation for customer satisfaction. By and large, a star rating by itself or a low star rating is not a reason to switch out of a plan. If there are multiple plans that may be better than someone's current plan, you know, a star rating could be essentially a tiebreaker. It's something to consider, but it's not going to be the sole determinative factor in the recommendation for someone's 2023 coverage. So at the next step after step 3 is the advice and possible enrollment. After you have done the analysis, after you have compared a person's current plan for the next year with other available options, you will always want to check with your mentor after you finish that analysis. You can also check with your mentor if you have questions as you go along. I'm sure some will come up. They'll be more than happy to talk with you. But once you feel like you have come up with a final recommendation, it's really important then to talk with your mentor and run your recommendation by your mentor before taking any further action. You want to print and save as a PDF the plan details for their current plan, as well as for other plans that you're recommending if you are in fact recommending that someone switch plans for next year. And also when checking in with your mentor, you should highlight any concerns that you have regarding the low-income subsidy, Medicaid, QMB, Medicare Advantage, anything like that. Just if anything has come up that the client has questions about or that you are worried about, that's a good time to discuss with your mentor as well. After you speak to the mentor, you'll go back to the client with the final recommendation. Changing plans is ultimately a client's choice. And again, you know, some people may not want to sort of jump through the administrative hoops of switching plans. Even if you find a plan that's a little bit less expensive over the course of the year, something like that, people may ultimately decide they want to stay in their plan, and that's fine as long as they're, you know, have all the information to make an informed decision. If you're not recommending a plan change, then you should inform the client, but then you don't need to complete an enrollment. People who do not take action to change plans for the following year will simply default into the plan that they are currently in for the following year. You'll check again with your mentor on executing the client's preferred course of action. If it's different from what was previously discussed, you know, if someone indicates they want to change a plan, but then they decide they don't want to, it's a good idea in that situation to double check with your mentor again and make sure that that's all okay. But again, ultimately it's a client's choice on whether they change a plan or not. And then you'll want to document the steps that you took, and if there is any follow-up necessary after making that final recommendation and or plan enrollment. Then at step 5, you know, there may be some situations in which it seems like there's not a particularly good option for the client. You know, maybe the current plan that someone is enrolled in is not going to cover a medication, and maybe you're having trouble finding a plan that will cover a medication they need in the following year. Sometimes this comes up. It's not super common, but it's certainly not unheard If the issue is high costs, there is some troubleshooting you can do. And again, this is a good idea. This is always a good time to check with your mentor if you feel like you don't have any good options. But just some things to think about, are you including an excluded drug in the search? For example, if someone is taking a drug that's not covered by Medicare, maybe they're getting cost sharing assistance through some other means. But if that's included in the search and it's not covered, it's going to bump up the drug cost. You can try generic versus name brands as an alternative. Is there a pharmacy network issue? Is someone going to a pharmacy that is not in the network of a plan that you're considering for 2023? That can drive up costs as well. And sometimes if people can go to a different pharmacy, one that is in network, that will lower the cost substantially. If no plans cover a particular medication, you can exclude it from the analysis just to make sure that all of the other drugs will be covered by a plan that you're considering, and talk to your mentor at that point about some other possible steps you can take. Is there a substitute for the non-covered or restricted drug? If there's just one drug that is causing a problem, oftentimes a client can talk to their doctor. Maybe the doctor would recommend another medication that will meet that client's needs and will be covered. One example is inhalers. Many patients are prescribed an albuterol sulfate inhaler, usually ProAir or Ventolin, but people should generally use Ventolin for the search because that's going to be covered, whereas I think ProAir is harder to find drug coverage at this point. And again, just talk to your mentor. I know I've said that a lot, but as these questions come up, if you have unique problems that are specific to a individual client, your mentor can help you hash through what the best course of action will be. Since we're still doing this remotely, we just have a few remote work tips, ways to try to get in touch with clients as we are not doing these clinics in person. It's helpful to be paperless as possible. Rather than printing out plan details or enrollment information, you can save those documents as a PDF through Medicare.gov. And that way you can email them either to the client or to your mentor so that you can discuss what the options are. Ask clients how they prefer to receive their information. Sometimes clients will have email addresses, and that's fine. Some clients may not have email addresses, and you'll need to do it through regular mail. Some clients may prefer just not to receive it, especially if they're not changing plans. As long as you talk them through their coverage for the next year and they're okay with that, it may be okay to simply not send those documents to them through email or through regular mail. In this world of spam, clients may be reluctant to answer calls from numbers that are unknown to them. So again, if they have an email address, you could try reaching out by email as a way to schedule a time to call, and that way they'll know who is calling, even if they don't recognize the number. Whenever you speak to someone, it's a good idea to let them know that you're working with Whitman Walker, or if you're working with Legal Aid, that you're working with us, so that they know who you are. A lot of clients will be familiar with the Medicare Part D project, even if it's the first time that they're speaking with you as their attorney for this project. And then just general security matters, try to avoid storing files on thumb drives, USB drives, removable hard drives, anything that could be easily lost or stolen. This is obviously personal sensitive information for these clients. If you store data on a local computer, please put it in a separate dedicated folder that you can just delete when all the work for this open season is done. So in terms of next steps, I think consultations, I've already mentioned, this is being done remotely this year, so these will be done by phone or virtually. We're grateful, obviously, for as much time as you can give. That marks the end of my presentation in the PowerPoint, and I am now going to return the presentation over to Jess for going through the online protocol. And I am going to stop sharing my screen and allow Jess to share their screen.
Awesome, thank you. And we will start with the general search. And I think we are sharing. Okay, great. Okay, great. So just gonna click through. I know in the protocol, again, we walk through each of these steps click by click, but sometimes the word on the paper is not very clear. So we're gonna actually do it. And it's pretty straightforward, like we discussed earlier in the slides with the personalized search. You're using the username and password, and you're already taken to the person's homepage with all the information. So in general search, it's going to be just a few extra steps before we start with the drug and pharmacy information. So again, you want to be at medicare.gov plan compare /. This is going to, so you don't have to click through the extra screens on the medicare.gov homepage. This is the graphic for this year. In the slides, it was different. It will continue to change. But the main thing, again, we're looking for is login, which is here, and create account, which you can go through here. And then general search is still continue without logging in, just has a little different look to it. So of course, we're doing 2023 plan analysis for the individual. And we're gonna go through, I would say, a fairly typical client. And so I'm just using Whitman Walker zip code here. And as we also mentioned in the slides, we're always doing drug plan Part D only. So when we're going to be searching, we always want to do drug plan Part D only. You have to click apply and then start. And so as we discussed, it's important to know the person's cost assistance programs. If the intake form you receive is unclear, please follow up with your mentor just to make sure you're getting that accurate estimate. As we discussed, if the client has QMB, they would select Medicare Savings Program, and we can also see the list of them here. If you wanted to double check, that's available. If the person has QMB and Medicaid, we would select Medicaid because that is for a needier category. And if the client has QMB, Medicaid, and SSI, we would select Supplemental Security Income, SSI. And so that would make sure we're getting the best estimate for this client. So we're going to say our client has QMB and Medicaid. So we're going to select Medicaid, which is the highest tier. And you don't have to remember this, I promise. It's in the online protocol, bolded, so it's very clear. You can double check in this section. And then once we have it selected, we'll click next. We always want to see drug costs. That is really how we do our analysis. So this will always be yes. Again, graphics may change, but it's always going to ask these same questions. And then with the general search, it takes you right into adding the drugs. So again, if you have a client with a lot of drugs, it's helpful to have the personalized search because a lot of them are already in there and they are saved, but sometimes, it doesn't work out. But it's not too bad. I have to say they have updated it. So it is a little more intuitive. So one thing that's great, and I'm going to enter 5 medications just to show you the different things you want to look out for, things that might give you error messages or create issues with the analysis. So we'll do a common drug. And what's great is once you start typing, it's going to pre-populate similar drugs. So it's important if you have a drug that, say, at the end says HCl on your intake form, that's hydrochloride. But it might have amlodipine hydrochloride. And so you want to make sure that you're selecting the appropriate drug name based on what's written. So if there's 2 options and one has that total name with the HCl, that's the one you want to select. So in this case, it's just amlodipine. So what this dosage is, and there are other options, the reason why this comes up is this is the most common prescription. And so we want to make sure based on the intake form that we are getting both the milligram correct, whether it is a tablet or something else, and how many per month. So obviously the client takes 1 per month, we say 30. Even if a month has 31 days, we average it to 30. And so if a client, so in this case, we'll say this client takes 5 milligrams 4 times a day, and that would mean 120 every month. And we're going to add that to our drug list. So we confirmed that the milligrams are right for the drug. And all of this is really important because it's going to determine those quantity limits and other drug restrictions. It's going to create issues with that if there are errors based on what Andrew discussed earlier. So we have a couple more drugs. We're going to add another, and this one is we're going to do Biktarvy, and this is a common antiretroviral. All the antiretrovirals many of our clients take, there is only one dosage, or actually this one has two now, but they're a very limited dosage and they're usually always once a month. So pretty straightforward. And then we confirmed dosage, we confirmed quantity per month. Then we will add, this client has vitamin B12 listed on their intake form. So we're going to put vitamin B12 in. And so I wanted to show you all this because, you know, in your training materials, you have the list of excluded drugs. And so make sure to review that before you're doing your analysis, because it sort of paints the picture of what you know, the clients don't know what's covered and not covered. They're just going to give you their whole medication list. So we know Part D is not going to cover over-the-counter drugs. It's not going to cover aspirins. It's not going to cover vitamin B12. We know that from that excluded drug list, right? But when you put in vitamin B12 here, it does come up. But the point here is that the vitamin B12 clients take is 1,000 mcg of a tablet. And what's available is a solution, and you can tell because it's also sold in a vial. And this is likely a shot that's administered, and that's why it's available through Part D. But this is not what most clients take. I would say most of them, you will see it's a tablet. So another reminder to make sure you're looking at if it's a tablet, if it's a cream, if it's a drop, if it's a spray, because this looks like, oh, this person will have vitamin B12 covered, but now we see it's actually the solution, and that's not what the client takes. So we will cancel this. And so the final we want to add is the client has written that they take albuterol. And you'll see this often as well. So when you try to, well, albuterol is the generic version, and Andrew mentioned this before, of a standard inhaler. And so although it is the generic, and although every client for the most part is going to fill their prescriptions through the generic version, the inhaler is the one exception. So if you have albuterol, like Andrew said, you're going to want to instead select Ventolin. So this is the one exception to the standard that all clients will use generic drugs. When you put in a brand name, which Ventolin and ProAir are, this is also in the materials, for albuterol, it's going to prompt you always to try the lower cost generic version. In any other instance, for the most part, you are going to do this. If you have a brand name in your medication list, you're going to want to select add the generic. However, this is the one exception to that rule in the inhaler world, which we see a lot, is you actually want to add the brand name because for some reason the generic is not covered by most plans. So we will select a Ventolin. You see it has the same dosage, that 90 base, and we'll say, one inhaler per month. Okay, so now we have a section to confirm our drug list. And you can just verify one more time if you need to here. Obviously the vitamin B12 is not there because we figured out that's not the tablet, that's not what the client takes. So we don't want to add it to our analysis because it will throw off the numbers and the plans that are available. So once we've confirmed that, our drug list looks good, we're going to say we're done adding drugs. Also at that screen, you could add more if you need to. Say you move forward and you realize, oh, I forgot one. The best way to go back is to go back to drug selection. So it'll prompt you to just go ahead and start entering drugs again. But if you want to go back and say, let me look at that drug list one more time, you have to actually click it again. And that will take you back to this list so you can confirm. If you use the back button, it just takes you back to entering the drugs. So if you want to see the list, it's better to click internally. So we're done adding drugs, we confirmed our list, and it's going to take us to the pharmacy selection. And so in the personalized search, again, there's a very clear button that says edit my pharmacy. It takes you to this screen. In the personalized search, there's a button that says edit my drugs. It takes you to the last screen with the drugs on it. So it's very similar. This aspect of the drug adding and the pharmacy and the analysis is basically the same for both types of search. The only difference is how you add, how you log in and how you add the drugs to the account. Okay, so For this client, we're going to say they go to Whitman Walker Pharmacy. And you'll see that our zip code here is populated. We do have clients that live in a different zip code than where they get their medications. Some folks who live, say, in Maryland and get their medications in DC. If you're looking for the pharmacy, you can add distance, and that allows you to search further than just that local zip code. So if you select Find My Pharmacy, I selected Whitman Walker. Instead of having 25 results, I just have 2, and that's 14th Street, which is our Northwest location, and Martin Luther King Jr. Avenue in Southeast, which is our Max Robinson Center. So we have checkboxes this year for folks to indicate which pharmacy they use, but instead of scrolling, you can also search the name of the pharmacy. So we're going to say this client attends our Northwest Clinic. And then we're going to add one more pharmacy because this client also goes to Alpha Peoples, which is around the corner, and could not find that. Let's try it one more time. Okay. There it is. So then we'll add one more pharmacy. And this often happens, clients who we know just maybe have people in their community that everybody goes to the same pharmacy. And some people like to have a second pharmacy for certain medications for discretion or other reasons. So if your Part D intake has multiple pharmacies, it's important that you add them here, as many as you need. And you'll see at the bottom, they're just added here so that they can be included in the analysis. You can have up to 5 to compare, but you want to make sure they're included because we do need to make sure that the pharmacy is in network. So it's important that we list all of them. And then when we're done, we can just go here. We've added both of our pharmacies, and now it's going to take us to our plan comparison. As we can see here, we can check that we're looking at 2023 plans, because you have to click the link to go to 2022. The plans are automatically sorted by lowest drug and premium, but there are other options. We recommend that always we want to, because of our clients, most of them have LIS status, we always want to check by lowest drug and premium cost. So that should be automated, but if it's not, make sure that's selected. If this is a personalized search, up at the top here, you'll have the client's name, and you can click link to their Medicare profile. And then it's also showing you here the zip code location. And so if you're in the personalized search, your current plan will be here at the top. It will be indicated, a little highlighting. So it's easy to have your comparison. So for this client, we don't, this is a generalized search. So we don't know, we know the current plan based on the intake, right? So if we know this client has Cigna this year, then we actually need to print these plan details because that's how we know what currently the person is set to enroll in for 2023. So we always need the plan details. If you're doing the analysis, we always need the plan details to be able to confirm the analysis. So in order to do that, you would go in here, select plan details, and then you can review first. And so it's really easy here. We know this plan covers all of the drugs. Our client, we know, has LIS, so we expect there to be a $0 monthly premium. And this is all noted here. So this is reflecting the LIS coverage. We see in this section that both of the pharmacies are in network. This will be a red X if it's not, and that will also drastically change the cost of for annual copays and premiums. It shows here the expected annual drug costs for each drug at each pharmacy. So you'll have all of this broken down for copay estimates to provide to the client. And then it's also summed here. And so what we're seeing is slightly different at both pharmacies, but what we would say a low annual drug cost. And so this is showing it by month. And as Andrew talked about earlier, this is the catastrophic area where the client will not be charged copays. but they will expect copays at the beginning of the month, at the beginning of the year, excuse me. And then this shows changing copays for both pharmacies. And then you can click through all of these here. So as Andrew mentioned before, you want to click view more drug coverage. And that's what this section was. So we've collapsed a couple of them, but view more drug coverage is important because this is just giving you some general pricing, but we're really looking at this section. And this is the drug restriction section, other drug information here. So it shows you the tiers of the drugs. It shows you what we talked about in terms of prior authorizations that are required. So there are no prior auths for any of these drugs. It looks like there's only quantity limits for the Ventolin inhaler, and that you can press the yes here and it shows you 36. So you can have 36 inhalers in a month, and clearly we are under that amount. So that quantity limit is not an issue, and there's no step therapy. Like Andrew said, I'll just reiterate, if a plan has step therapy, it's something to avoid. If it's the best plan and it has a prior authorization, those are fairly standard with providers, but obviously you want to try to go for the plan that has neither if possible. And then this is just reiterating the drug list that you entered. So that's why we also asked to print the plan analysis, the entire plan details for your mentor, because when we review, we can see in here also the quantity limits in comparison to the intake. And also a great place to be able to check. And so as again, we have star ratings here. As Andrew mentioned, more or less stars is not a reason to select a plan over another. We're really basing it on cost. And so we would print here. You can control P or use this print button here. And as we said, since we're doing it remote, we'll print that to PDF. So you want to indicate, these are the current plan details. So this, in this case, looks like this is the best plan for the person next year because it continues to cover all of their drugs. So we'll go back to the search results with that internal back button. And we see there is a plan above ours that's Humana Basic. Because as Andrew mentioned, it's more of a challenge for folks to switch their plans. So in this case, it's still the lowest annual drug cost. It's a fairly standard cost. It starts to go up a little bit as we scroll to other plans, but it looks like there are many plans that will work. And we're starting to get in non-LIS plans here that are also fairly affordable, but they include a monthly premium, which you can see here. And I wanted to also show Elixir Secure. So if you all worked with us last year, you might be familiar with Elixir Secure, which is LIS in 2022, but it is the one LIS plan that will no longer be for 2023. So next year, Elixir Secure will have a $2.70 monthly premium. So folks who are going to continue to be in that plan will likely need to be switched out so that they can get a zero premium plan. But that is, and you'll have this information in the plan comparison chart in your training materials. But so we see for this client, the Cigna Secure plan, the 6825 is still the best for them. And so in that case, there's no change that's needed. If the client did not have a drug that was covered, these numbers would be in the tens of thousands of dollars. And so you can see these are pretty standard drugs. So almost every plan covers it. But with clients who have less standard drugs, you'll know that a plan is not covering a drug or that someone's pharmacy is out of network because this annual drug estimate is in the tens of thousands of dollars. And so, as we said, this is an estimate of their drug costs. So if, say, this Humana plan was only $60 or $55 of annual estimated cost, and this was $68, I would say that's probably not a reason to switch somebody. I know that's $20 a year, and not to say that's not important, but because it's an estimate, they might not actually experience those savings at the pharmacy. And so changing the drug plan and having to get the new enrollment and the new cards and provide the information to the pharmacy can be a lot for people. So we really want to switch people when they don't have drugs covered, the plan has unnecessary drug restrictions or drug restrictions that limit their ability to fill their medications fully, or like in the Elixir Secure situation, they will have a premium next year and we can get them into a plan that doesn't have one. So we're really looking at the cost savings here. And so again, we'll want you to print the plan details and print the PDF, and we can review that. And then if you do decide to switch plans, you will want to also, as Andrew mentioned earlier, discuss the options that you found, the recommended plans that you found to switch to with your mentor, and you'll want to print those plan details as well. And so the enrollment option is not available here yet. It will be on the 15th, this Saturday, and when your cases are available, or when the placements become available. And so we will have the step-by-step enrollment process that is also outlined in the online protocol document that's attached. And so one last reminder for the enrollment, again, we're making sure all information the client has is accurate based on the intake information that we have. We want to make sure, again, that we're discussing with the client first and obtaining their verbal consent to enroll in the new plan, and then confirming with the mentor and enrolling the client. And the enrollment page, the final enrollment page, is what you'll want to also print to PDF. That's also critical because that's going to contain the confirmation number, which is really the most critical in terms of if there's any issues after the fact, after the enrollment. And so I will go ahead and stop sharing my screen here. Okay. All right, and of course, as Andrew mentioned earlier, if you're going through the website and you've entered the drugs and you sent the plan details and it's like, this is just not working for this person, definitely, reach out to your mentor earlier so we can help think through any LIS questions, any drug restrictions, pharmacy, drug issues. We can help you with that earlier.
Are we ready to turn over to questions?
I think so, yes.
And actually, maybe before we do that, I can quickly give people a quick preview of next steps. In terms of next steps, some of you will be assigned to legal aid and some of you will be assigned to Whitman Walker. And by the end of next week, you'll hear from the organization that you've been assigned to with next steps regarding the clients you'll be assigned and the processes that will apply for each of our organizations, since we do operate a little differently. But thank you. And I'll move over to questions, it looks like, in the chat box.
Yes, and I just responded, if a drug is covered by DC ADAP, that drug is listed on the DC ADAP formulary, and that you can search that formulary online, but we've also included a printout of it with the training materials. And so in that case, if you see a client has a high copay, if that drug is under the DC ADAP formulary, ADAP will pay those copays for the client. So it might look like you have a high annual cost, but you can actually reduce by all the drugs that are covered by ADAP. And a lot of it is antiretrovirals, but there is a lot of other things that are also under that umbrella, like blood pressure, cholesterol, mental health, antibiotics. So make sure if it's marked in your intake that the client has ADAP, that you're looking at that formulary so actually a lot of these copays might be paid by ADAP when they go to the pharmacy.
I see a question in the chat about, will this recording be shared with us for reference? I'll defer to Sylvia or Lee on that.
Yes, we'll share the link to this by Monday, after our IT folks are able to edit it a bit. But we'll send the recording to you, and then, like I said, by the end of the week, you'll hear from the organization that you've been assigned to with next steps. And we've been talking to, we've been mentioning mentors, and there's different resources that you'll have throughout this process. And I think for those of you who are new, it's important to know that you're not in on this by yourselves. You do have someone who you can turn to when you have questions that go beyond our training materials. We'll share all of that information, again, because both of our organizations, while we do this project, while we collaborate on this project, we do operate our programs a little bit differently. So it's best that I just say that the organization that you've been assigned to will share more on the resources that they'll be sharing, and the time frame, as Lee points out, that Whitman Walker does generally have quicker turnarounds, 2 weeks to complete the work that you do. So I think that should help. If you have any other questions, let me know.
I see a question. If a client goes to more than one pharmacy, will they have potentially higher or twice the deductible? That should not occur. I think the thing to keep in mind about the pharmacy is to make sure that the pharmacy the person is going to is a network pharmacy for either the plan they will be continuing in the following year, or for any plan that you are considering enrolling them in for the following year. The thing is that even if a drug is covered by a particular Part D plan, if they are going to an out-of-network pharmacy, they could still have higher copay costs. So I don't think it should affect the deductible, but I think it could make their overall costs higher if they're going to an out-of-network pharmacy. And then in the past, I recall that beneficiaries could switch enrollments more than once during the open enrollment before the January 1st start date. I think that is still the case, although I will double check. I think yes, so they're allowed to make one change that is effective, but I think the last change they make is the one that would be effective for January 1st. I'm correct about that, Jess, to the best of your understanding as well?
Yes, that's correct. And it's essentially the last enrollment of the open enrollment period. So we would have the opportunity to switch it. I obviously wouldn't recommend. I feel like there's always opportunity for confusion with something like that, but it should be the last enrollment of the enrollment period for that person. Good question.
So I see a question about a lot of pharmacies closing in DC. Do we expect this will affect our process this year more than usual? I don't know that we're necessarily on guard on that particular issue. I mean, it may sort of pan out that way, that there are just kind of fewer options that people have to go to. I mean, another thing I'll say about pharmacies is that in my experience, and Jess can speak to their experience as well, and Whitman Walker's, generally the big pharmacies like CVS and Rite Aid and whatnot tend to be participating pharmacies with most of the plans that you're going to be considering. There are some smaller pharmacies, I think like Alpha, People's Pharmacy, Grubbs is another one that people have liked in the past, that are not part of those nationwide chains that sometimes people like to go to, and they have relationships with those pharmacies. Those can sometimes be a little bit trickier. It can be a little bit harder. I would say in recent years, even those pharmacies haven't necessarily presented an out-of-network pharmacy issue. It does come up sometimes though, and every now and then if someone is going to a smaller pharmacy that just doesn't have relationships with as many of the Part D plans as like CVS does, that can be something that you need to discuss with the client. Fortunately, it doesn't happen all that often, but I have had a handful of situations where someone has sort of had to decide if they want to pay a little bit more for their medications and go to the pharmacy that they like, or if they're willing to go to a different pharmacy and pay so that they can pay less. And that's just a decision that the client has to make, obviously with the guidance from you, getting guidance from your mentor.